Well, the impact of the coronavirus pandemic is weighing heavily on the minds of millions of Americans nationwide. According to the CDC, more than 54% of the country has received at least one dose of the coronavirus vaccine. And this has led most states to lift their mask mandates. However, the World Health Organization now says that everyone, including fully vaccinated Americans, should continue wearing masks. And the announcement comes as the deadly Delta variant, again, first found in India, spreads rapidly overseas. So for more, let's bring in Dr. Jessi Gold. She is a psychiatrist and an assistant professor in the Department of Psychiatry at Washington University in St. Louis. Thanks for joining us, Doc.
Thanks for having me.
Dr. Gold, most parts of the United States, as you know, have lifted their mask mandates. So how could this somewhat conflicting guidance from the World Health Organization add to the additional stress that Americans are going through right now?
Yeah, it's very reminiscent of the mask changing rules from the beginning. And I think that people, when things are reminiscent, people often have reactions to them. Either they remind them of the things from the past, or it gives them anxiety from the past, or new anxiety, and any sort of uncertainty and changes or things that are inconsistent causes anxiety. And we have a lot of things right now that are enough anxiety provoking situations, like returning to work, returning to school, going back to quote unquote normal. So I think having conflicting recommendations just makes it a lot harder for people.
Yeah, and when dwelling on the past, at least the last year, the past was not pleasant to us, to say the least. Hospitals, they're dealing with a wave of mental health related issues from patients who have been otherwise unable to receive treatment during the pandemic. They were locked down like everyone else. They were isolated, unable to seek treatment. So what are some of the issues that doctors are seeing most, and what are some ways that those patients can cope with those issues?
Yeah, I mean, we've never had enough mental health providers in this country. It's been a problem for a long time, especially for kids, but we've just never had enough mental health providers. So when there's a surge of things like we have high rates of anxiety and high rates of depression right now, we have increasing rates of substance use, we have some studies suggesting increasing in self-harm and some suicidal thoughts. And if you have all of that, you say, okay, I'm struggling, where do I go? And if you don't have a provider, or you call 10 people and they don't have appointments, you're going to go to the emergency room. And the problem is there's not much the emergency room can do besides make you wait there, or maybe you'll get a bed in an inpatient psychiatric ward, which has for years and years always been full. So it just puts a lot of strain on our emergency resources. It puts a lot of strain on our already strained mental health system. And I think we'll begin to see a lot of the cracks in the mental health system as the need increases, just as we did with the cracks in the regular healthcare system as COVID increased.
Yeah, plenty of stress and strain to go around. Now, we know that the 24-hour news cycle can sometimes be overwhelming. So do you think the coverage of the pandemic is at all contributing to ongoing mental health crisis nationwide, the stress and anxiety people are feeling?
It's really hard. I mean, we get our news from so many different places. It changes all the time. You know, you can watch it online. You can watch on social media. You can change a channel and have a bunch of different news 24 hours a day. And I think with having all that information and having a lot of it be negative, it's hard to imagine that that's not hard on people. I mean, the data from something like September 11th suggested the people who watched more of the, videotape right after or watched it for longer times had more of a risk of developing PTSD. I think we would be scared that that would be the case for people who are watching this a lot. I think one of the things to pay attention to is if you're watching the news or you're scrolling social media and you're having really strong emotional reactions, you should ask yourself why and wonder if you should be setting limits, and if you should be saying, I shouldn't be doing this before bed, or I shouldn't be doing this when I wake up, or I shouldn't be doing this X number of hours a day, and really trying to manage it, because I think our social media use and our news watching can make a big difference to our ability to sort of like cope with this in general and move forward at all.
Finally, millions of young Americans graduated high school remotely this past year. As someone who specializes in mental health at the college level, what advice do you have for students who will be attending class in person this fall for the first time?
I think it's to be nice to themselves. I think that we, like, as workers and as students, we all have this thought that it's just like we have to go back and it has to be exactly the same and it's going to be the same for all of us and it's going to be easy because we miss our friends and we miss people. But I think it's not going to be easy for everyone, and that's okay. It might be easy for you, and that's awesome. But if it's not, I think be nice to yourself about it, because anything you're feeling, if you're angry, if you're anxious, if you're sad, if you're worried, it's a very valid feeling, and it's okay to have, and it's okay to do baby steps. It's not something you have to immediately socialize with all your friends right away. If you're more of on the nervous side of things, or you're more fearful or anxious, it's absolutely okay to take your time till you feel comfortable. That's a normal reaction. Anything you're experiencing is normal, and I think it's important to know that we have the spectrum of reactions to this, so we need to be nice to ourselves and to our friends and colleagues when that is the situation.
Yeah, don't be so hard on yourself. That's good advice for anyone. Last question, could isolation impact this incoming freshman class and the students' abilities to fit into a new school?
I can only imagine that it's been a really hard time for people to socialize and really know what it means to socialize. I mean, even if you think about yourself, I'm sure I've had trouble even kind of reintegrating, and I'm an extrovert. So it's very hard to remember what social skills are. And if you weren't a person who really enjoyed them before, it probably only heightened your social anxiety. If you're a person who was doing okay, but was slowly becoming more comfortable with it, I think it could make it a lot harder to sort of reintegrate, to know who to trust, to know who has the same, anxiety or fear around the experience to you. You have no idea what other people have experienced during the pandemic. So I think that's also really hard, because your experience could be vastly different than someone else's. And that can make it really difficult in terms of like how you processed it, or how you're dealing with it, or how you even react to it now. And that can make finding friends and finding a social network pretty difficult, especially in a new place, especially when you're already dealing with identity formation in a completely new school at a time when, a lot of changes are going on and you're already trying to fit in.
Dr. Jessi Gold with the good advice, not least of which, be nice to yourself. Thanks, Doc.
Absolutely. Thanks for having me.